What is the difference between BCG and Mitomycin Intravesical therapy? Have you ever wondered about the different treatments available for bladder cancer? Two commonly used options are Bacillus Calmette, Guérin, often called BCG, and Mitomycin. Both therapies are administered directly into the bladder, but they work in very different ways and are used for different types of bladder cancer. BCG is a live, weakened form of the bacteria that causes tuberculosis. It was originally developed as a vaccine for tuberculosis but has been found to stimulate the immune system to fight bladder cancer. When BCG is placed in the bladder, it triggers an immune response that helps the body recognize and attack cancer cells. This makes BCG particularly useful for treating intermediate, risk and high-risk non-muscle invasive bladder cancer. It is considered the standard treatment for these cases because of its effectiveness in preventing cancer recurrence and progression. On the other hand, mitomycin is a chemotherapy drug that works differently. It directly damages the DNA of cancer cells, preventing them from growing and dividing. This cytotoxic action leads to cell death. Mitomycin is typically used for low-grade or low to intermediate risk non-muscle invasive bladder cancer, especially when BCG is not an option due to side effects or availability. Recent advancements have even allowed for home administration of mitomycin, making it easier for patients to receive treatment. When it comes to administration, BCG is usually given in a clinical setting. Patients receive weekly treatments for several weeks, often followed by maintenance therapy. Mitomycin, however, has traditionally been administered in outpatient clinics, with newer formulations allowing for at-home use. Both treatments come with their own side effects. BCG can cause local bladder irritation and urinary symptoms, as well as systemic effects like fever. It requires caution in patients with weakened immune systems because it is a live organism. Mitomycin's side effects are generally related to irritation of the bladder lining, leading to symptoms like cystitis. While its systemic toxicity is lower than that of traditional chemotherapy, allergic reactions can still occur. In summary, BCG is an immunotherapy that activates the immune system against bladder cancer, mainly for higher-risk cases, while mitomycin is a chemotherapy agent that directly kills cancer cells, often used for lower-risk cases. The choice between these treatments depends on various factors, including the type of cancer, patient health, and treatment goals. Always consult with a healthcare provider for personalized advice regarding bladder cancer treatments.